Welcome to the Thyroid Life podcast with me, Dr. Rebecca Warren. I'm so excited for you to join me on this journey. This podcast is for you if you're wanting to know how to heal and best support your body after thyroidectomy or after being diagnosed with a thyroid dysfunction. I was diagnosed with thyroid cancer, had my thyroid removed, high-dose radiation, and my gallbladder removed, all by the time I was 20. By the time I was 21, I had health issues, struggling with depression, anxiety, brain fog, weight loss resistant, and it wasn't until I drew a line in the sand and decided to take my health back did things start to change. I spent the last decade and a half implementing protocols and healing strategies to reclaim my health and take it to the next level. On this podcast, I'll be sharing the most up-to-date studies, biohacks, and protocols, my own personal journey and recommendations on this healing path. I'll be bringing in experts in different fields of health to help you understand what you need to know to take back your health, as well as sharing my own clinical experience and coaching others that have been on this same journey. My hope is that when you listen to this podcast, you have the knowledge you need to get started and you feel empowered to take your health to the next level. All right, welcome back to the Thyroid Life podcast with Dr. Rebecca Warren. And I'm so excited to be talking about this topic, myths, misunderstandings, and misconceptions after being diagnosed with a thyroid disorder. I honestly don't think I could have picked a more complicated title to say, but this is important. I came up with the idea of this podcast because of conversations that I've had this past week over and over again about different points that people, like women that I work with, they didn't understand when they first got on a thyroid medication or when they were first diagnosed with a thyroid disorder. And so I wanted to create this as a resource because, yes, there's a lot of information out there. Honestly, we're living at a time of information overload, but in a doctor's office, there tends to be a lack of information. So there's things that you believe that are not true, or things that are not discussed, or things that you should know that I want to make sure that you know, right? That you understand what it means to have the underlying thyroid issue and what it means to do something about it and to do something about it in a long-term type of way. Because I think we don't talk about that enough, is about the long-term journey of having an underlying thyroid issue. But let's go ahead and jump in. And this first point, the first point I'm about to share was actually the second point on my list, but I'm going to share it first because it's something that has happened multiple times now, again, just in the last week. And every time I try to explain this point, it's really hard. It doesn't really click with the women that I've spoken to because it's not discussed enough, right? So the first thing I want you to understand, a first misconception is that if you get on the right dose of thyroid medication, that's just the same dose you're going to be on, all right? So the truth is that being on the right dose doesn't mean you're always going to be on that same dose. It doesn't mean that that dose is always going to be the right one for you. And so this point is going to be connected with another point I want to make that you have to understand. Another myth, another misconception is that just because you're on medications doesn't mean that's correcting the underlying thyroid issue. Those two things are really important misconceptions that people have or that they're being told, right? And so let me explain both of those together. Right? So when you have an underlying thyroid issue, depending on how long you've had that underlying thyroid issue, right, you could go into hypothyroidism where you're not having enough active thyroid hormone, that free T3 that binds to the cell. And if you do not have enough of that active thyroid hormone, you're going to feel like crap, right? You're going to gain weight. You're going to have brain fog, memory issues, fatigue, digestive issues. You can have skin issues. There's just a wide range of symptoms that you can have. And if you're in that hole of hypothyroidism, which means you're on the low end of the range for free T3 or out of the range for free T3, you're going to feel like crap. And so there's always a time and a place. And if you're in that place, getting on thyroid hormones can be life-changing if you get on the right dose, which that is going to be another myth we're going to talk about after these 2 points, right? But if you get on the right dose, then you can start to feel better, right? But in my practice and how I teach it is that you get on thyroid hormones so that you can feel better, and that's not where you stay. The goal is to then identify the underlying trigger to your thyroid disorder. The point is to get enough hormones in your body to feel better, to now find out what caused that thyroid issue to begin with. And that's a process, right, where you have to dig deeper. So a lot of times you get on thyroid meds or thyroid hormones and you feel great. But you've got to understand that there's all these steps, right, that you have to take in order to make active thyroid hormone that binds to the cell and goes into the cell. There's all these steps from the hypothalamus, the pituitary, the thyroid itself, from the liver, the gut, the kidney, the cell membrane. There's all these different steps. And so by getting on the thyroid hormones, you're putting in the end product, right? Which again can be life-changing, life-saving. It's amazing if you've been in a hypothyroid state. But again, you're putting in the end product, which means that whatever dysfunction was there is still there, even though you feel better. And if that continues, then eventually you're going to need more and more and more thyroid meds to feel the same way you did at the beginning. Right? So number one, just because you're on the medications and you start to feel better does not necessarily mean that you've addressed the problem, which leads to the other misconception that I touched on, is that what you might feel good at the beginning might not be the same amount down the road. And let me give you an example, right? The most common cause right now, or the most common issue right now for hypothyroidism, like the cause is autoimmune thyroiditis. So something like Hashimoto's, right? And so when we're looking at Hashimoto's, it's an autoimmune disorder. You know, there's an imbalance within the immune system where these lymphocytes start to attack, you know, your body, right? Your tissue and your thyroid cells, your thyroid tissue. And the thing that isn't, you know, that I find in conversations that with women that I coach and I work with that have had this and have had this for a really long time, is there's this misunderstanding of what happens if those antibodies are there long term, right? Remember, it is your immune system attacking your thyroid, which eventually can cause thyroid cell death, right? There's an endocrinologist here, and it's interesting that he says it this way. But I had two women that went to go see him for ultrasound, and they had, you know, underlying thyroid autoimmunity for a really long time. We're talking about decades, both of them. And on two separate occasions told them that when he saw their thyroid on imaging, it looked like a dog had chewed it up. And spit it out, right? That's like pretty much like shriveled and destroyed. And that's a really big deal, because if you have thyroid cell death, not only does that cause it can cause a roller coaster of hormones and how you feel. You can go from feeling hyper to hypo, but eventually you're going to need more. And so things that I hear is like, well, you know, I felt great on Synthroid 20 years ago, or this thing, you know, normalized, you know, this one drug, you know, thyroid drug normalized my hormones 10 years ago. Well, guess what? It's not just the drug, but it's the dose. If your thyroid continues to become dysfunctional, if the conversion issue continues to exist, you will need more thyroid medication over time. Much, much more. Right? You've got to understand that. The thyroid isn't this stagnant thing where you're going to make the same amount every day for years and decades. That's insane. Our thyroid is dynamic and it changes according to the needs of the body. So not only do you have the possibility that your thyroid cells are being destroyed, but if you gain weight, if you lose weight, if you're really, really stressed out, if you have a lot of inflammation, if you're eating more sugar or you know, toxic foods, you know, your thyroid would change according to whatever's going on in your environment, internal and external environment. But it's not going to do that If it's having an underlying issue, it's not going to be able to adapt to those stressors. So again, understanding that having those thyroid antibodies there, having the underlying issue there, will mean more medication down the road to feel like you did at the beginning. That's huge, 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 huge to understand, right? Now, as we're talking about this, let's talk about getting on thyroid meds, right? So I've had individuals, this is another misconception, and, misunderstanding. Actually, I would say it's more of a misunderstanding. I've had individuals that will try different meds at different times throughout their lives, and they're like, oh my gosh, such and such didn't help me. Oh my gosh, this didn't help me, right? Like I just felt like horrible. I felt X, Y, and Z taking this thyroid med. So, misunderstanding is that you can just get on a thyroid med and then that's it, right? Or that you can go from Synthroid to Tyrosine, or that you can go from Synthroid to Armour Thyroid and there's going to be this linear conversion. That is completely false, right? When you're switching thyroid meds, it's vitally important that you keep retesting and rechecking until you're optimal, until you get to the levels that make you feel and function well. Okay? So that means if you're getting on a thyroid med or you're switching them, you have to get tested, blood work every 4 to 6 weeks to make sure you're well. And it's not just the blood work, right? You have to look at your symptoms. What are things clearing up for you? Now, if you have some other underlying things, we'll touch on that. But like if you have some other underlying issues going on, then you're not gonna feel completely perfect just getting to the right dose. But you should be noticing a change. You should be noticing some type of shift, some type of difference when you get onto the right dose. But this idea that, hey, I tried this, the doctor put me on it, and then the doctor's like, okay, we'll just get you on 90 micrograms or whatever, and just sends you on your way. That's not how that's going to work. You don't know how much you need until you tweak it and until you see those changes. So that's a misunderstanding. Now, there are some people that feel better on different thyroid meds or combination thyroid meds. Now that's different. Like if you get to that right dose and you just don't love it or you don't convert well, that's different than, yeah, we tried it and maybe, I retested one time or I didn't retest at all. That's not how that works, right? You've got to retest and you got to know exactly, where you need to be. Now, another thing to understand, especially, if being on thyroid medication, is that there's going to be the idea that once you get on the right dose for you, everything should be good, right? Once you get on the right dose for you, you should be losing weight, brain fog should be gone. It should all just be amazing. And yes, that does happen sometimes. But the longer I am helping people and I practice, the more I'm seeing that happen less and less. Does that make sense? The more that happens, less and less. I don't know if that cancels each other out. What I'm trying to say is that I see more and more people getting those hormone levels where they need to be, and they still don't feel great, right? That's just not how it works all the time, right? Because two different things to understand is that not only can you have another underlying issue that's making it, difficult to get those hormones where you need to be to feel great on it, but also those other underlying issues can give you symptoms like hypothyroidism. So you think you still have all your hypothyroid symptoms when in actuality, you don't. You have iron deficiency, B12 deficiency, right? You have anemia. You have adrenal HPA dysfunction. So what does that mean? Let me give you an example of iron, because that's why I never just do a thyroid panel. I never just look at TSH, free T4, free T3, antibodies, and reverse T3. I look at a lot of other labs as well. And let me give you the example of iron, right? iron deficiency, anemia. It can be, serum iron, ferritin. That's why you want to do the good full panel, right? But when you have low iron, you can have a lot of symptoms of like fatigue, hair loss and hair changes, heart palpitations, feeling inflamed. A lot of symptoms of anemia look like symptoms of hypothyroidism. And so if you are within this range and you've sort of seen better changes, but not like how you are expecting it or how you thought you would see it, then it's time to take a step back and be like, you know what? I need to dig a little bit deeper, right? And when it comes to the adrenals, what you've got to understand is that there's this connection, right, between your adrenals, your thyroid hormones, your sex hormones, and your hypothalamus and your pituitary. Now, the adrenal is so vitally important. In fact, I think having the adrenals well is one of, adrenals and insulin balance, hypothalamus, pituitary, like those are things that you should always work on first before going on into deeper things, whether it's gut healing, detoxing, whatever that may be. But what you've got to understand is that those adrenals, were without you even thinking about it, right? Your hypothalamus, your pituitary, like your hypothalamus is looking at its internal and external environments constantly, right? Without you even having to think about it or be aware of it. And the purpose is to determine, are we safe or are we not safe? Do we need to be in sympathetic or parasympathetic? And when the thyroid becomes dysfunctional, you see those adrenals really kick up, right? You get into this very sympathetic state, having a release of cortisol to make up for this lack of this vital thyroid hormone, right? And so I want you guys to understand that underlying adrenal issues, which is actually HPA dysfunction, not adrenal fatigue, right? It's not that your adrenals are like kaput, they're just not making any cortisol. That is actually a disease, right? HPA dysfunction is the brain's, the way that it's communicating with your adrenals, telling the adrenals what to do or what to not do. And the thing is with underlying adrenal issues, it can look differently depending on the stages that you're in, right? And people, like, when women are sitting across from me, they're like, well, I don't really feel fatigued. And when I start going down this list of all these possible ways that HPA dysfunction can show up in their life, they're like, oh, right? So let me give you a few examples here, right? HPA dysfunction, it could be, you wake up in the morning and you're fine and you have energy, and then you feel like you need a nap around 12 to 3, right? You're just, oh my gosh, I need a nap, I need coffee, I need something to get myself to the evening. Or you feel fine throughout the day, but when it's time to lay down to go to bed, you have a million thoughts running through your head. You're tired, like you're ready to go to bed, but you're wired and your mind is running scenarios and thinking anxious thoughts, right? You're just running things through your head. Or you can be tired. You can be tired throughout the day, and so you sleep 10 hours through the night and you're still tired when you wake up. That can be an adrenal issue. Or you're sleeping 7 or 8 hours, possibly, sometimes 5 or 6 for other people, right? Maybe you, not a good thing though, but you could be sleeping through the night, but you're not getting into a deep enough sleep, that delta wave sleep, in order to start burning fat and detoxing, cleaning your CSF fluid. You're just not in a deep enough sleep. And that's something that you can track with something like the Oura Ring, right? Or you wake up tired. You're just tired and it takes you an hour or so, and God forbid you don't have your coffee, right? Like in the morning to get you through. Or you wake up in a panic in the morning, or you wake up in the middle of the night between 2 and 4 a.m. I mean, again, depending on how long that underlying adrenal, HPA axis issue has been there, that dysfunction has been there, depends on where you can be along that path. And that's why it's really important to get tested, right? It's really important to do a cortisol awakening response test to see what's going on, especially in the morning and throughout the day. And you guys can find out more information about that on my website, drrebeccawarren.com, under tests. But the adrenals, iron, anemia, low B12. These things can contribute to things like hypothyroid symptoms, even though you're on the right amount of medication for you. Now, this next, kind of myth, I would say this one's more of a myth, is this idea that, you can be on high amounts. I want to word this the right way because I don't want there to be any misunderstanding. Obviously, that's the whole point of this episode. But how can I put this so that you guys can truly understand it? If there's inflammation in the body, okay, here we go. I got it for you, right? A high dose of thyroid medication doesn't necessarily mean it's too much thyroid medication for you, right? That being on a high dose is too much for you. Now, let me clarify this, right? I want to go back to this thing, this idea, right? That your thyroid isn't this separate system where it doesn't affect something else and something else doesn't affect it, right? A lot of times, if we're not careful, we can think of our bodies like they're these separate systems functioning on their own, like the GI system is on their own, the endocrine system is on their own, the reproductive system is on their own. And I'm not surprised that a lot of people think this way because that's kind of how medicine works, right? You go to your GP, you have a menstrual cycle issue, you go to an OBGYN, you have a gut issue, you go to a GI specialist, you have a brain issue, go to a neurologist, right? So we really do. And when you go there, they only focus on that system. But that is not at all how that works, right? And the biggest thing to understand, when you are taking something like thyroid medication is gut absorption issue and cell receptor sensitivity. What does that mean? Is that sometimes you might be on a high dose because you're not really utilizing that total amount of thyroid hormones, right? So if you have underlying gut issues, so if you have a lack of microdiversity in the gut, if you have pathogens in there, viruses, parasites, things that are really disrupting the balance that should exist in your gut, you're not going to digest things as efficiently. There could be a decrease of digestive markers like enzymes and bile, and you're just not absorbing as much as you can, right? As you could. And so if you're taking these high dose of thyroid medication and your numbers look, that's a big red flag. If they're just on the low end of the range, that's a big red flag that you're not, taking in enough of those nutrients. But a second thing to understand is the same way that there can be insulin sensitivity issues, right? We know that type 2 diabetes can be an insulin resistant issue where it's not binding to the cell, getting glucose into the cell. The same thing can happen with your hormones, guys. And I think this is definitely not talked about enough, is that binding to cell receptors is necessary. Like that having these receptors that bind to these hormones, your T3, is necessary. And inflammation, bad fats, there's all these things that blunt the sensitivity to those receptors, so that what ends up happening is you're not really utilizing all the hormones that you could, right? And this happens a lot to people with underlying, having their thyroid removed, is they should be feeling good on a certain amount, but they don't. And that makes sense because, you have blood sugar issues, you have high C-reactive protein, you have all this inflammation. And so your binding capabilities are decreased. And so if that's the case, it sucks when a doctor's like, oh, you're on too much, because you're like, but I feel good on this amount. Or when they cut it back, you start to feel like crap. So this idea that it's not affected by something else is just a big myth. It's something that you have to understand, that there's this connection, and whether you make the hormone or you're taking the hormone, it has to go through a process, and every step in that process has to be well to have a good end product. Now, let's go ahead and go into some myths about different types of medications. And I'll tell you this, I've heard so many throughout the years. I experienced some myself because even though I'm a doctor now, I was a patient. That's why I do what I do, because of what I went through in my own health. And it was really shocking and surprising to me to hear a lot of misinformation about utilizing T4, T3 combination therapy, like medication, or just utilizing T3. And I'm going to try to hit on a few different myths that I've heard about it, that I've heard, but I'm sure there's more. And if there's a myth that you're like, you know what, my doctor said this, or I heard this and this, go to my website. This episode is it's on my website. Leave a comment and let me know if there's something that you've heard that, we should clarify, because I'm going to try to touch on what I know are the most common ones. And so the biggest one, the myth, and it's been a myth, it's not as big of a deal. It's not as big now as it was like a decade, I feel like a decade and a half ago. But when I was needing to switch my thyroid meds to T4, T3, natural desiccated thyroid hormone, you wouldn't believe how freaking hard it was to find a doctor to prescribe it. But there's so many doctors that do it now. And let me go ahead and tell you this, because this wasn't on my list, but I'll throw it in there. It's a misconception, right? A lot of times we go to one doctor and, we just kind of go with that one doctor, right? We stick with the same doctor for years, and my doctor said this and this and this. And you know what? Which is what you should do. Of course, let me give that disclaimer. You should talk with your doctor about making any changes. But what I think is really interesting is that you can go to one doctor down the road who went to a certain school that had certain experience, that's been exposed to certain studies, and they'll tell you, no, you can't do X, Y, and Z, or no, that, that's different information than what's true. But then you can leave her office and go down the road to another doctor's office. And if they're more up to date on the research, if they have personal experience with it, if they're a little bit more passionate, or if they were exposed to a different study, or if their professor taught something slightly different, they're going to give you a different, point of view, a different medical advice. And I think that's a big thing that we can get stuck on, that women that I've worked with can get stuck on, is like, well, my doctor said this and this. Well, why don't you check with someone else and see? Because if someone has more experience with something, if they feel more comfortable with it because they read up on it, they have personal or clinical experience with it, they're going to feel comfortable to do it with you. Now, if you go to a doctor that doesn't feel comfortable with it because they don't have a lot of experience with it, they like to stick to the same thing, you're going to get different advice. Again, if there's a doctor that does, has a lot of experience with Armour Thyroid, knows how to track it, knows what to look for, feels comfortable with it, they're going to tell you this is a great thing. Let's do this, versus a doctor that's always done the same thing the same way. It doesn't take into consideration, more recent studies about how thyroid patients can feel on T4, T3 combination. Then you're going to hear someone tell you, oh, you can't do it, right? Like I hear, oh, it's pig thyroid, or, there's no way to really know how much thyroid hormone is in it. It's not safe, or I'm having a brain fart here. They always say like there's, it can vary, right? It can vary from lot to lot. You're not getting the same amount. But the crazy thing is if you go online, you're seeing just as many recalls on Synthroid, on T4 only medication as T4, T3 mixed medication, right? It's a medication. They're not going to, this thyroid medication, this Armour Thyroid has been on the market for decades, right? It's not like you're going out and eating a pig thyroid. That's so gross to think about. But it's processed, it's weighed out, and your body has these checks and balances system in place, like with your reverse T3, with thyroid binding globulin, that when you give it enough of the hormones, the body will do something with it, will keep it in check, right? But, this misconception is that, the natural desiccated thyroid hormone, or glandulars, are not stable, that there's no way to kind of like keep you in stable ranges. That's completely false. That's completely false. And you yourself can see that if you are on it and you test it, right? If you test it regularly, the problem is that if you go from T4, like I mentioned already, if you go to T4 to natural desiccated thyroid hormone, there's no linear conversion. You have to tweak it. You've got to work with your doctor and around like how much you need by how you feel in testing it. But this idea that it's not stable, that you can't be stabilized on it, is a myth, right? Now, I do believe that for different reasons, we're all individual bodies, right? We have this bio-individuality within our bodies. So, if you're converting right, if your liver's functioning well, you might do completely fine on T4, and that's all you need. But if you're having conversion issues, right, you might do better in T4, T3, or, you're making enough T4, but you're having too much reverse T3. Well, you might do well with T3. You've got to understand that, there's different ones that might be better for you, but this idea that you can't possibly try something because there's something wrong with that med is false, right? Another myth that I hear is that, oh my gosh, T3 can cause heart issues, like heart palpitation and these, heart attacks possibly. I heard one person say that. I don't know if doctors are really saying that. Here's another one is that like T3 and older population, they can't try it, they can't do it. And there's a lot of doctors I work with in my city that do it with, the people I work with. If I refer to them, they'll be like, I say, go talk to them about what med you need to be on, and they will monitor them on combination therapy. But let's talk about that. Let's talk about this idea that like T3 is this, super horrible, dangerous thing. Now, too much T3, too much of it is a problem, yes. It's the same way if you had hyperthyroidism, right? You have too much T3, it's the opposite of having too little, right? Hypothyroid means everything kind of slows down. When you have too much T3, everything revs up. Heart beats faster, blood pressure goes up. You could have headache, you could have difficulty swallowing. Having too much T3 is a problem, which is why working with a doctor that understands how to utilize T3, you can avoid those problems, right? You can't, you can't get on these high dosages on your own. You got to work with someone that knows how to go low and slow and monitor your symptoms and do blood work, right? It can be completely avoided if your doctor paid attention to you, right? Again, I see it over and over again when someone comes to see me and they're working with me to get their whole body well, because I do not prescribe medication. I don't treat that, right? I work with the body as a whole. I look at imbalances. I look at stresses. But when someone comes to see me and I refer them out to a nurse practitioner here or an endo that, I work with, they'll go in and the doctor's like, yeah, you're a great candidate for this. Let's, try it, right? If they have a conversion issue, right? If you don't have a conversion issue, it's not really necessary. But why would someone feel so much better on T4, T3, right? Like, why would that combination feel better, right? Well, let's go back to conversion, right? That T4 only medication has to be activated. It has to be turned into the T3, right? It does so predominantly in the liver, the gut, some in the kidneys, but predominantly in the liver, right? And in the liver, you make some reverse T3 and mostly free T3. Now, we know that. So if your conversion is down, so there's something in the liver, there's something along in the process. So you have good amounts of T4, but that, let's say like what I tend to find is that T4 is like in the middle of the range, of their lab range, and then free T3 is on the low end of the range, right? That's a big red flag, especially if there's symptoms along with it, right? And there's a high reverse T3. That's red flag conversion issues. So until you can find out, like, why am I not converting my T4? Putting in some T3 can help, because remember, it's the T3 that's going to efficiently bind to the cell. That's what's going to make you feel good. That's what's going to get rid of your brain fog and memory loss, and normalize your menstrual cycles, and makes perimenopause and menopause an easier transition, right? It's that adequate amount of T3. So making sure that you have adequate amounts of T3. that's why T3 can be helpful for some people, because if they're on T4 only, then you're not really converting it efficiently, right? You're not going to have enough T3. But this is the other thing that I think is disappointing that we don't talk about enough, right? Is that obviously, I think I've said that multiple times now, because there's a lot we don't talk about enough, which is why I do this, right? But the thyroid itself, the thyroid gland itself, doesn't just make T4. Yes, it makes mostly T4, but it does make some T3. And I think that says a lot about the intelligence of our body, because the process of making T4 and then converting it and binding it is going to be a longer process than just utilizing T3. And that's how intelligent our body is that it creates this T3 to be utilized quicker as you're going through the process of making and converting T4. And if we want to mimic, if something's wrong with our thyroid and we want to mimic what the thyroid is doing, it would make sense that, maybe some T3 would be helpful, right? If we want to mimic what our thyroid gland really does on its own. So, those are the common, and I'm sure there might be more. Again, go to my website, drrebeccawarren.com. Let me know if I missed any. But this misconception that, hey, you can't try this because you really want to try it. You've had issues and you've been on T4 long term. Is not true. And I'll tell you this, and I've seen it through the years. It was very shocking. I actually, when I was a patient, I was going to my pharmacist every 30 days. I don't know why they didn't give me a longer dose, but I remember having this conversation with my pharmacist on this weird thing that I noticed as a patient, this really big push for name brand Synthroid. And Synthroid at the time, and I think it still is now, I would have to double check that, but was one of the top prescribed medication in the US, competing with statin drugs, thyroid medication. And I wouldn't be surprised if this still is, but there was this huge marketing push that Synthroid is the only option on the market. And that's not necessarily true, right? And I remember speaking to my pharmacist, because it was when I first started asking questions, right? Really starting to say, hey, maybe this could be different for me. And I asked the pharmacist, and I was like, because he asked me, he's like, oh, I had tried this generic, and there's a bold line that said, no, only Synthroid name brand. And I was like, name brand, huh? It looks like they really just want to get money into Synthroid's pocket. And he's like, no, that's true. And we had this whole conversation about how, different brands and different formulations can work just as well for you. And it doesn't necessarily have to be the same for everybody. And it shouldn't be the same for everybody. And so, all that to say, I've given you all these different things, and I get a lot of inspiration from the women that I work with that come into my office or do virtual coaching, or my membership, the members in my membership group, the questions that they submit. I get a lot of this information, and I think to myself, all right, how can I present it to you guys so that you guys can have this information? Even my goal is always, even if you don't work with me one-on-one, that if you wanted to, you can take all the information I'm sharing and do something, right? Change things, start asking questions and getting yourself better. So guys, that's the wrap up of today's episode. I feel like, as I'm wrapping this up, I'm like, you know what? I feel like this episode's going to end, and then I'm going to be like, wait a minute. There's 4 more things I want to touch on. So I'm probably going to do a part 2, as if you comment on my website, on my blog, that, heck, I heard this or I heard this, and maybe, if I get to pull up some studies and do some, more talking, I will come back and I'll do that episode. But guys, just make sure that you tune in, you subscribe to my podcast so you can know when new episodes are popping up. And if you enjoyed today's episode, make sure to leave a review. Let me know where you're listening from and how this is helping you, because again, I know I'm not sitting physically in front of you, but I'm talking to you guys as if I was talking to the members in my membership group, to my coaching clients, because my hope is that a lot of the unnecessary suffering that I went through, that it can be avoided for you. All right. Hey guys, Dr. Rebecca here, the Thyroidless Doc. So glad you were able to tune into today's podcast episode. If you enjoyed today's episode, I ask that you subscribe to the Thyroidless Life podcast so you can stay up to date on all my new episodes for you, and leave a review. If this was helpful for you, just let me know by leaving that review and tell me where you're from. I love to see who's tuning in and where they're from. You can also connect with me at my website at drrebeccawarren.com, as well as on Facebook and Instagram at Dr. Rebecca Warren, also the Thyroidless Doc. On Facebook, I have a free Healing After Thyroidectomy group. I created this group in hopes of having a community for people to join where they want to get better, where they want to take back their health, they want to reach the health goals that they want to reach, and they can feel encouraged by others that are on the same journey and being led by me. So I hope you find us on Facebook at Healing After Thyroidectomy group. Can't wait for you guys to hear the next episode.